about camps as well.
So,
first of all, what is camps? A lot of people are like, camps? Are we going to camp, right? Wound care and camps. What could go wrong?
The only kind of camping I do is glamping. Let me just put it that way. And there has to be wine involved too. So the CAMPS conference, for those of you that aren't aware of the nomenclature. So skin subs, CTPs, those are names that we've given to like amniotic tissue products, acellular dermal products, but really the current nomenclature is CAMP. So it's cellular, acellular, and matrix-like products. And I was lucky enough to sit on a panel, a consensus panel that came up with that mnemonic, and we published a consensus guideline on those products. So Journal of Wound Care was where we published that, and they are the supporting industry representative that puts on this symposium. It will be in March down in West Palm Beach, and let me make sure I have the dates, 6th and 7th. So March 6th and 7th of 2026, again at the Hilton at West Palm Beach. And this conference is really kind of a niche conference, and I think it's great for any advanced practice providers, so MDs, DOs, PAs, NPs, anybody who is applying CTPs or CAMPs to their patients. I think you can get a lot out of it. It's also industry supported, so again, a lot of the manufacturers and distributors of these products are there, and you get really education across the continuum. So you see some innovations that are coming out there. I know we've talked this year, I'm on the planning committee, so we're looking at 3D printing and some of these novel electrospun matrices, peptides, and some of these really new advancements that are making that translational, jump from the benchtop into the clinic. And then you also understand about billing and reimbursement, which is always a hot topic when we're talking about camps. And it's a smaller conference. There's about 350 delegates that are there. So I kind of like a smaller conference because you get a lot of good networking opportunities as well. And hey, it's March in Florida, me being from Ohio,
there are worse things.
There's worse places to go. Absolutely.
Mm-hmm. Mm-hmm. Great. I think that's a great synopsis. One of the things I really liked about camps is I felt like it was a place that I could talk with advanced practice clinicians and really ask questions and get answers, and bring some of that high level technological speak, if you will, kind of down to a level that was digestible, that I could okay, I understand this and I know how to take this and kind of bring it forward to teach other practitioners, and especially to look for medical necessity and all those things that we need to have in place, before we're even thinking about applying camps.
And I think that's a great point, because there are a lot of these products out there in the market, and we always get asked, how do I know what to use at what given time? Mm-hmm. And so understanding the science, the mechanism of action, so that you could say, okay, at this time, this patient's wound needs X, and determining what CAMPS product has X or can support X in that patient is really important. So understanding that really complex science, that preclinical work, and seeing how that translates into the clinic, and choosing the best product for the best patient at the best time, you can get some of that insight from that conference.